Welcome back to our channel. If you're new here, don't forget to hit that subscribe button and ring the bell so you never miss an update on groundbreaking scientific discoveries. A revolutionary breakthrough in medical science has just taken place. A 58-year-old man in the United States is the first person in the world to have his failing heart replaced with a temporary titanium blood pumper. This incredible device, created by BiVACOR, looks like it was designed for the Tin Man, but is actually a marvel of modern engineering. It's called the Total Artificial Heart, or TAH, and it's designed to replace the full function of a human heart for as long as possible. Unlike traditional artificial hearts, BiVACOR's TAH doesn't beat like a real heart. Instead, it uses a single, magnetically levitating rotor to pump blood to the lungs and the rest of the body. This design eliminates friction and mechanical wear, making it virtually unbreakable. The device is powered by a small, external, portable controller that exits through the stomach, ensuring continuous functionality. After 10 years of development and countless animal studies, the BiVACOR artificial heart was implanted in a patient at Baylor St. Luke's Medical Center at the Texas Heart Institute. The surgery was a success, and the titanium heart functioned perfectly for 8 days until a real donor heart became available. The patient's doctors reported that the device worked very well, marking a significant milestone in the journey to finding sustainable solutions for end-stage heart failure. BiVACOR's founder, Daniel Timms, expressed his pride in this groundbreaking achievement, highlighting the dedication of the team and the bravery of the patient and their family. Currently, the best treatment for severe heart failure is a donor heart, but only about 6,000 heart transplants are performed worldwide each year. Artificial hearts, like BiVACOR's TAH, are crucial for extending and improving the lives of patients at risk of imminent death. In November last year, BiVACOR received FDA approval to implant its TAH in up to 5 patients in 2024. With the success of the first implant, we can expect more life-saving surgeries in the near future. BiVACOR's heart represents a paradigm shift in artificial heart design. While we don't yet know how long the device will last in humans, it has been whirring away in the lab for over 4 years. The potential impact of a long-term, commercially viable mechanical heart replacement is enormous. It could transform the wait time for heart transplants from years to almost immediate availability, dramatically improving the quality of life for patients worldwide. If you found this video fascinating, make sure to subscribe and hit the bell icon for more amazing scientific updates. Thanks for watching.